My PICO question was, will long-term care nurses working 12-hour shifts as opposed to 8-hour shifts reduce fatigue and improve patient safety? My main sources of information were Medline, PubMed, and Google Scholar. Substantial evidence from various articles throughout these two websites either supported or opposed my PICO question of whether 12-hour shifts were more beneficial when it came to fatigue and patient safety as opposed to 8-hour shifts. The different studies were found in each article from these websites. The validating organizations were the American Journal of Critical Care, Effects of Critical Care Nurses' Work Hours on Vigilance and Patient Safety, Occupational and Environmental Medicine, Changes in Nurse Decisions Over 12-Hour Shifts, and the American Association of Critical Care Nurses, The Effects of Critical Care Nurses Working 12-Hour Shifts, the American Nurse Today magazine, Are 12-Hour Shifts Safe?, and the Healthcare Traveler magazine, Reconsidering the 12-Hour Shift for Nurses. A wide variety of sources were thoroughly researched in order to obtain evidence and information answering my PICO question. Medline PubMed was one of the main sources I used in order to gather my information. I found many trials and studies from many different articles that I felt were all very strong and provided substantial research. Although I went into this thinking I was going to find the answer that I wanted to my question, I was surprised to find that many studies opposed my view and were backed up by substantial research and studies. Validating organizations were also thoroughly researched to include the American Journal of Critical Care, the American Association of Critical Care Nurses, and Occupational and Environmental Medicine. Knowledge brokers such as the American Nurse Today magazine as well as Healthcare Traveler magazine helped me view my research from many different perspectives. Going through my knowledge brokers helped me to view the information from the personal perspectives of people and other healthcare professionals on the question. After reading through many articles and studies done on the topic, I found many conflicting results. 12-hour shifts can be beneficial when it comes to staff morale and satisfaction, but my main focus was looking at nurse fatigue and patient safety. One study performed by Ugrovics and Wright on fatigue in nurses during a 12-hour shift found that during the last hour of a 12-hour shift, nurses had an increase in fatigue and a decrease in patient safety. Their concentration was also decreased as opposed to nurses working 8-hour shifts. There was also a lower quality of care found in nurses working 12-hour shifts during the end of their shift. Another study done by Bowers, Hutto, and Davis found that several nurses working 12-hour shifts reported having poor judgment when working and slower response times. The study randomly chose a group of nurses who worked 12-hour shifts and nurses who worked 8-hour shifts. The nurses were given simple response tasks after their shift and during their shifts. After completing the simple response tasks, the nurses who worked 8-hour shifts had quicker reaction times than nurses who worked 12-hour shifts. The study concluded that nurses who worked longer hours have an increase in errors and reduced patient safety while at work. One study done by the Multi-State Nursing Care and Patient Study surveyed nurses in 4 different states on fatigue and burnout. They found that although 80% of nurses were satisfied with their schedules, 7 out of 10 nurses reported being fatigued and burnt out. The rate of fatigue and burnout increased as their shift length increased. Patients were also less satisfied with their care when nurses were working 12-hour shifts, and this also proves that nurses' attentiveness to patients' needs decreased. Patients reported that nurses who worked longer shifts rarely communicated with them, and their pain levels were increased due to lack of attention from nurses. The study also found that nurses who worked 12-hour shifts complained of fatigue and lack of sleep. It was found that nurses who worked 12-hour shifts as opposed to 8-hour shifts reported lack of sleep and a messed up sleep schedule, whereas the nurses who worked 12-hour day shifts as opposed to 8-hour day shifts reported not much difference in their sleep schedules and fatigue when compared to each other. Another article and study done by the American Association of Critical Care Nurses found that in 502 nurses working long shifts, there was an increase in errors that might not have occurred if they didn't work 12-hour shifts. The American Nurse Association found that on a collective study of 5,317 work shifts, there were a number of errors that occurred with nurses who worked longer hours. 199 out of 213 errors found in the study were medical administration errors. This proves that patient safety is at risk. Medical administration errors are not errors that can be reversed. The final conclusion of the study was that the longer duration of shifts nurses work, there is a higher probability for errors when it comes to patient safety. Although many studies have found 8-hour shifts to be more beneficial when it comes to long-term care nurses' fatigue and patient safety, some opposing studies have also been done and found research that contradicts this. One study done by Williamson and Rose concluded that nurses who worked 12-hour shifts reported an increase in their well-being and a decrease in their fatigue throughout the shift. Work efficiency was also shown to increase. This study also found there was no link to patient incidents and safety as opposed to 8-hour shifts. In this study, two groups of chemical workers were assessed. One group worked the 8-hour shift and the other group worked 12-hour shifts. The group who worked the 12-hour shift reported more alertness throughout the day as opposed to the 8-hour shift. The shift work and safety research group argued that the bulk of evidence they found suggests there are not many differences to the 12-hour shift over the 8-hour shift, and that an increase in physical well-being of the staff and better sleep patterns were found in nurses who worked the 12-hour shifts as opposed to the 8-hour shifts. Although the study mainly viewed both shifts pretty much the same, there was still a small concern with the 12-hour shifts on patient and staff safety due to the longer hours. I also found a study done by the Agency for Healthcare Research that looked into fatigue levels of nurses who worked in long-term care settings as opposed to physician clinics or other settings where the physical demand was less. For instance, ICU nurses versus nurses who work in a rehab setting are very different when it comes to physical demands on the body. The study found that nurses who worked with the elderly, with children, and nurses in hospitals reported to have more fatigue and sleepiness on the job. The nurses caring for children and elders reported much higher levels of fatigue than nurses who worked in less demanding jobs. Nurses who provided elder care in the home reported way more fatigue than any other nursing field. It was determined that in this field, these nurses should never work overtime and should be limited to how many 12-hour shifts they should work. While there are many opposing views and many different studies either supporting or not supporting nurses working 8-hour shifts over 12-hour shifts, I think the best solution would be to form a set of guidelines the staff has to follow in order to reduce fatigue and improve patient safety. I do not think that completely doing away with the 12-hour shift is the answer after reading through these studies. I would propose staff only being allowed to work 2 12-hour shifts in a row as opposed to 3 or 4 12-hour shifts in a row. Also, staff should not be allowed to work 2 12-hour night shifts and then work 2 12-hour day shifts directly after that. If staff works a 12-hour shift, it needs to be at the same time as the last 12-hour shift in order for the nurse to get enough sleep. This could decrease the rate of fatigue. Nurses who work with elders, children, and in-home help should not work more than 1 12-hour shift in a row and should never work overtime. These nurses should also be limited on how many 12-hour shifts they are allowed to work. Nurses should not be allowed to work overtime when working 12-hour shifts. Based on the research, we know that an increased duration of shifts increases fatigue and decreases patient safety. But there is also a shortage of nurses. I believe the best solution is for healthcare professionals to pay more attention to each individual nurse and make sure their schedules are not more than 2 12-hour shifts in a row and that they do not differ in times. This should be the same for nurses working 8-hour shifts. Their shifts should be the same. They should not work 2 shifts in one day, and they should not work an 8-hour day and then do an 8-hour night shift. This seems like an easy solution, but it was reported in many of the different studies and from my own personal experience that oftentimes nurses end up staying overtime during their shifts, do not get enough breaks or sleeps in between shifts, and are being overworked. It seems simple to fix, but it takes more communication and more attention to detail with scheduling. The act of simply paying more attention to each nurse's needs can make a huge difference in the workplace and improve nurse and patient safety while decreasing the rate of fatigue. Monthly educational classes should be held for nurses in every facility, ensuring they know the risks of fatigue while on the job and how to prevent it as well as understand it when it happens. By doing this, it will promote more conscientiousness while on the job and improve patient safety while enabling nurses to know when they are too fatigued. Each shift, there should be a supernumerary nurse on call in case another nurse becomes ill or fatigued while on the job. Educating nurses on fatigue, as well as having a shift coordinator who specifically ensures each nurse is not being overworked, could greatly reduce fatigue and improve patient safety for the 12-hour shift as well as the 8-hour shift. After implementing the new scheduling practices for both the 12-hour shifts as well as 8-hour shifts and ensuring nurses are not overworked, another study should be done by physicians and researchers on whether or not the new implementation worked. The study should be done on both nurses working 12-hour shifts and 8-hour shifts and should tell whether patient safety increased and nurse fatigue decreased after implementing this new policy. A randomized study of whether or not nurses found the educational classes on fatigue to be helpful should also be done, as well as proof of whether or not patient safety increased as a result of these classes. The incidence of error should also be evaluated after the new policy is put into place. Physicians and healthcare administrators are to study and oversee the results of this new intervention and report which aspects of the new intervention worked and which did not. This could enable healthcare administrators to form new interventions that could improve the old ways even more. The results will then be discussed among healthcare providers as well as healthcare administrators in order to see if this new policy should be implemented for the future and remain in effect. It is only with the continuous support of each healthcare provider, nurse, and healthcare administrator that this new policy will work. The success of this new intervention depends on everyone, and without working as an interprofessional team, this new policy will not be able to be achieved.